This is my presentation on borderline personality disorder. Borderline personality disorder is a mental disorder characterized by unstable moods, behavior, and relationships. The signs and symptoms of somebody who has borderline personality disorder are plunging into relationships or ending it just as quickly. There's also intense and unstable relationships, family, friends, or loved ones. There's also unstable self-image, dangerous behavior. Dangerous behavior can include anything up to speeding excessively, unsafe sex, substance abuse, reckless driving, binge eating, self-harming behavior, thoughts of suicide, and then other symptoms would also be intense mood hours to days. So pretty much if they go through these intense moods, it can last anywhere from hours up to multiple days without it changing, without it going away. There's also a chronic feeling of emptiness that comes from having borderline personality disorder. You just feel like you're empty. There's inappropriate anger, problems controlling their anger. They're angry for no reason. They have no idea why. They're just angry. And feeling cut off from the world. People often feel very cut off from the world when they have borderline personality disorder, feeling like nobody understands them. It is known that it is not known where BPD comes from or why it was caused in an individual, but it does coincide with other illnesses that help to determine that it is BPD. So illnesses that it can coexist with would be major depression, PTSD, bipolar depression, anxiety disorder, substance abuse, and eating disorders. A lot of the times BPD is paired with one of these or multiple of these. There are treatments for borderline personality disorder, and those treatments include psychotherapy, which is a one-on-one session with a trained professional. And there are two types of psychotherapy, which are dialectical behavioral therapy, which is developed for BPD. It was developed specifically for BPD, and it teaches skills to help people control intense emotions, reduce self-destructive behavior, and improve relationships. And then there's also CBT, which is cognitive behavioral therapy, which helps to identify and change a core belief from perception of themselves. So how they're feeling about themselves, it helps them to change that and realize that it's not actually their fault. So medications when it comes to borderline personality disorder, there aren't any known medications. They haven't developed a medication specifically for borderline personality disorder. They tend to more combat the symptoms of it than actually combating the disorder itself. So the benefits of these medications, they're really unclear. So they're not used as the primary way to treat the illness. The primary way would be the psychotherapy, which is the one-on-one session with a trained professional. But medications are used to treat the symptoms and how they're feeling. So since it's depression and PTSD and bipolar depression, there are stuff like antidepressants that the psychiatrist will put the patient on, as well as anxiety medication, things around the line of that. Now, the consequences if you go untreated with this disorder are a loss of interpersonal relationships. So you could end up losing the close relationships that you have because of the fact that you self-sabotage. There's also divorce. You could end up getting divorced in your marriage. There's not having a steady job. You could end up being super inconsistent with your work. There's self-harm, which we spoke about. So a lot of the times they don't want to harm somebody else, so they harm themselves. And there's also addiction, legal trouble, unplanned pregnancy from unsafe sex, health complications, and the biggest one, the most deadly one, suicide. The case that I want to talk about for borderline personality disorder is actually a very close friend of mine. I will not be saying their name due to, privacy, but this very close friend of mine, I did interview her, and we spoke about her borderline personality disorder. She did let me know that she The causes for hers, she feels, were because of being sexually assaulted when she was younger, as well as abusive, like an abusive kind of household with how her father was, as well as a, sorry, as well as because she didn't really grow up in a very loving and warm family. They loved each other very much, but they weren't very affectionate with each other at all. So that kind of contributed to the fact that she was not able to really express her feelings openly the way that she normally would have. And that's how she feels that it developed in her. She was actually diagnosed completely with a different disorder before. She was misdiagnosed when she had gone to her psychiatrist.
I'm so sorry.
Hey!
Amanda.
Sorry about that. Okay. So the case with her, she was misdiagnosed when she originally had gone to go see a psychiatrist. Originally, they had said that she just had bipolar disorder, which was not the case. She did try multiple different medications for depression and anxiety and everything else that they said that she had, but she ended up being diagnosed later on in life at 32 years old that she had borderline personality disorder. They went through so many different kinds of medications for depression that didn't work for her until she landed on the one that did work for her. So it was a lot of trial and error. It was also a lot of trial and error for her anxiety medication that she takes as needed, as well as her actual medication that's supposed to help the feelings that she's having, the overwhelming anger and the mood disorder itself. And she's taking that every single day. And it was a long time until she did find something that really did work for her. Now, how it's affecting her nowadays, now that she has already known for a while and been going to therapy and been doing everything that she can to kind of understand her disorder, now she is much more able to actually express herself and her feelings. She's able to control her urges to get angry, and she has not self-harmed, which has been a huge accomplishment for her. She no longer feels suicidal every single day. It's been wonderful. It's been a wonderful change in her. And that is all I have to say.